I just would like to remind everyone that this is cutting-edge technology. This is exactly the opposite of leaving the global south behind. And we should be really happy about that.
What are we doing with this technology? First, we are building capacity with support from the Tech Transfer Program, and we are establishing a dedicated mRNA R&D facility and training scientists in cutting-edge techniques. Second, we are advancing R&D by co-developing mRNA vaccines with private companies for leishmaniasis and rabies, and collaborating with mRNA tech transfer partners such as Afrigen in South Africa and Ficus from Brazil on vaccine candidates.
And now we intend to advance very quickly in the development of new products for neglected disease and cancer.
We are committed to collaborate with the partner to enhance our capacity and build a healthier future for Pakistan. I am thankful to NPP and WHO for providing this support to make our local R&D lab.
This program is a big opportunity for Kenya Biovacs because one, it is versatile, it is flexible, it allows us to undertake targeted product development and be able to get products to the market in a short period.
We believe the program that began with the vision of pandemic preparedness is now an enabler of the entire mRNA global ecosystem, allowing companies and institutions to expand into various applications of vaccines and therapeutics.
Our goal is to harness mRNA technology to strengthen pandemic preparedness and address unmet public health needs, especially in low and middle-income countries.
Synergion Biotech is building this world-class RNA facility that will allow our region to have full product development and GMP manufacturing capabilities, not only to manufacture our own products, but also to receive tech transfers from other program partners.
We plan to apply the mRNA technology for developing other vaccine needed in Vietnam, such as mRNA, dengue, and HPV vaccine.
mRNA-based therapeutics are the key for future treatments that can open the door to address unmet medical needs.
Our vision is to expand mRNA applications beyond COVID-19 to tackle endemic diseases, cancers, and the new treats yet to come.
We feel the daily support of WHO and MPP in every step we make. This progress would be impossible without the donors of the program. From the bottom of our hearts, thank you from earth to sky for making good things happen. We deeply value the trust that you have placed in us.
With continued support through the program, by 2030, our goal is to firmly establish an mRNA platform in Senegal, from R&D to manufacturing, and be ready to face any future pandemic in the region. We're building a future where life-saving mRNA capabilities are within reach for communities across the globe.
We have established required laboratory and in the process of establishing a GMP manufacturing facility for manufacture of complete mRNA vaccine. This has given us tremendous amount of confidence that at the time of need or any pandemic, we would be able to deliver the vaccine or therapeutics coming out of mRNA technology.
As we're putting everything together, we'll be looking at quite a few vaccines. We're looking at outbreak vaccines that will deal with pandemics. We're looking at possible vaccines that will go for maternal use, and even the routine vaccines we're looking at it. So we're still combing the landscape, but hopefully in a year's time I'll be able to come with a lot more specifics after we've opened our lab.
We're also very thankful to the team at Afrigen. As I said, we've been there twice. Found a team of young people, very impressionable, very patient, and I noticed that some of them have also become equipment experts.
We are in the process of completing the construction of an end-to-end, the first facility of its kind on the African continent, including research, development and manufacturing for mRNA vaccines.
We're grateful to the funders whose support makes this possible. South Africa, Belgium, Canada, France, Germany, and the European Commission.
Good afternoon and welcome to the Afrigen SAHPRA GMP Accreditation event. I am Jalise McCulloch and I am your MC for the evening. I think the video you have just seen is testament to what has been built in a very short period of time and how important Afrigen has been in helping all these program partners as we move further. Now, without further ado, I would like to welcome our host, Professor Petro Terreblanche, the CEO of Afrigen.
It's an enormous privilege for me to welcome you all here, and I greet our online participants, our partners, our collaborators, our friends, our suppliers to this meeting, and I thank all of you for joining us here today. On the 21st of June 2021, when the mRNA Hub program was announced here in South Africa by WHO Medicines Patent Pool, and BioVac, Afrigen and the SAMRC was designated the hub with an enormous task to develop an mRNA platform, to industrialize it and to transfer technology to 15 partners on 4 continents in low middle income countries, representing 4 billion people. An event like today was impossible to imagine. And today, 4 odd years later, we celebrate an achievement which we believe is a testimony to the people in Afrigen, and there are many, many of them here, our partners, our funders, and the absolute quest where failure was never an option. What we have built here and the offer we have for pandemic preparedness, pandemic response, but innovation for public health purposes is unprecedented. Today, you will hear testimonies and presentations to the testimony of what this team in Afrigen and all our partners and support have done. Thank you for coming and enjoy the day with us and the proceedings. Thank you.
Thank you, Petro. I'd now like to call our next speaker, Charles Gore, the Executive Director of the Medicines Patent Pool.
Thank you, Jalise, and thank you very much, Petro. This is not the first time I've been here to help welcome people to Afrigen, because many, many people over the last 4.5 years have wanted to come to Afrigen to see what's going on. Because this is such a unique program and the achievements that we've seen over those years have really been mind-boggling. I said to some of you earlier, the idea that in Africa we would have this kind of progress and a cutting-edge technology 6 years ago, before COVID, would have been unthinkable, and that what was developed here would then be transferred out across LMICs to make the world a better and safer place. And it's been our privilege at the Medicines Patent Pool to support this together with WHO. And just to say that much as Afrigen have been at the center of this, it has also been a lot of partnerships with the funders, and there are many of you here from the EU and also from particular countries that have supported this, and that's been a very important partnership. And then there's also been a lot of partnership around technology transfer, because you can't do technology transfer without a proper partnership. And Afrigen has worked really closely with the other companies involved in this, as I said, across the world in 15 different countries, to make sure that that tech transfer has worked. And again, we've been very happy and privileged to support that. And then that's really been phase 1 of this program, to create the platform and then to transfer it. And it's been really important that Afrigen should get this certification from SAHPRA now. But there will be a phase 2 of this. which is to make sure that this program is really sustainable, because there is no point having the capacity if you then walk away and leave it to stagnate. This capacity has to continue so that it's always there when we do get the next pandemic. And inevitably, Afrigen will have an extremely important part to play in phase 2. And all I can say is a huge congratulations to Afrigen and its team. And it's not just about product, it's also about building an ecosystem with extremely qualified people. As Jalise said right at the beginning, this was a very small company, and it's grown not just in numbers, but it's grown enormously in expertise. And we're delighted at the Medicines Patent Pool to have been a part of that. Thank you.
Thank you, Charles. And my next speaker, and an important partner working on this, of course, is Dr. Claudia Nane, who's the team lead in product development and manufacturing at the World Health Organization.
And it's really an honor to be here on behalf of WHO. As Charles, no, you've been here more than me in reality. I've been here 2-3 times, and indeed we have seen this organization grow enormously. But let me take a few minutes to give you the sense of how proud WHO is to have been together with MPP and Afrigen at the heart of this program. And today's GMP certification is not simply a technical or a regulatory achievement. It's very much more broader and more strategic. And it demonstrates that advanced quality assurance mRNA manufacturing capacity can be developed from scratch, as Petro always says, on the African continent, as long as it's grounded on scientific excellence, as Afrigen is demonstrating, strong regulatory oversight, and you have a national regulatory authority, SAHPRA, here that can provide that strong oversight. And as Charles was saying, committed partnership with many different groups. And we all started in this adventure, as Petro was saying before, to respond to the pandemic, to the COVID pandemic, that had exposed profound inequities and in access, obviously, to medical products and vaccines in particular. And many countries in this continent, but across the world, found themselves dependent on a very limited number of global suppliers, often receiving access to these products too late and at a too high cost. And one of the clearest lessons that we have all learned from that global crisis is that global health security cannot rely on concentrated manufacturing capacity alone. We need a more distributed, resilient, and collaborative model, one where countries and regions across the world have the capability not only to use and access those health technologies, but to develop, produce, and improve the technologies closer to where they are needed. And this is precisely what the mRNA technology transfer program was established for. And this is why Afrigen has become such an important strategic platform within that effort. And in just 4 years, Afrigen has progressed from a concept, it was a concept when we started, to a GMP certified end-to-end mRNA manufacturing facility. And beyond this technical achievement, really Afrigen represents something larger. It represents the emergence of manufacturing capabilities as a core component of health equity, health sovereignty, and pandemic preparedness. in many ways, Afrigen has become a public health platform and a global public good. We want to see you as a global public good because the capability built through solidarity and partnership has led today to an institution that doesn't serve one country or one objective only. It really contributes to a broader and more equitable global health architecture. Governments are discussing now global health architecture. We have just gone through the World Health Assembly, and we have one of the co-chair of the pandemic agreement here with us. That was Precious Matsoso from South Africa. We are still discussing on the pathogen and access and benefit sharing system. This discussion do recognize an essential principle that preparedness and response cannot depend only on the sharing of pathogens and scientific information. They must include fairer sharing of the benefits arising from that use. And for that vision to become a reality, we do need concrete platforms capable of translating equity into practice, and platforms like Afrigen are the clear representation of this. So, as Charles was saying, we are celebrating, if you want, the end of phase 1 of this mRNA program, but we must look at the future, at making this program sustainable and Afrigen sustainable in the future. We need stronger product pipelines, we need to advance even more partnerships. We need to continue to support the technology transfer and expand regional collaborations. I have to say that this progress would have not been possible without the commitment and support of many partners. And therefore, allow me to sincerely acknowledge the contributions from the European Union by several also individual European countries that have not only contributed financially, but that have invested also politically and technically. So thank you for your contributions. Obviously, WHO remains committed to continue to support Afrigen, continue to work with governments, regulators, manufacturers, research institutions, civil society, everyone that has so far been engaged. So let me just congratulate Afrigen again, congratulate the South African government, congratulate the governments that have invested in this endeavor. My very dear colleagues from MPP, without whom we wouldn't be here today, and thank you really for making this achievement possible. Thanks.
Thank you, Claudia. And I think it's good to remember that this whole idea, the whole idea of the mRNA program came from WHO. And Dr. Tedros himself has been to visit the facility, and it's been an honor to have him here, and he remains a good friend of Petros. But of course, when we started planning this event, we had actually invited him to join us, and he was open to coming here and being with us today. But as you saw in the news last week, a FAKE was declared. That's a public health emergency of international concern. An outbreak of Ebola is happening at the moment in the eastern Congo. 135 people have died already, and that's the number that we know. There is currently, for that strain, no vaccine. So we are again faced, at this moment with a situation where we don't know what's going to happen next. And it's really for that reason, again, that WHO set up this program and allowed us to get where we have. So I hand the floor to Dr. Tedros, who very kindly has sent us a message from Geneva before he left for the Congo.
Dear Professor Pedro Terblanche, Excellencies, distinguished colleagues, dear friends, I congratulate Afrigen Biologics on its certification for good manufacturing practice. Today marks an important milestone not only for Afrigen, but also for South Africa, the African continent, and for global health. The COVID-19 pandemic exposed deep inequities in access to vaccines and other tools. Part of the reason for those inequities is because manufacturing was concentrated in a handful of countries. 4 years ago, we came together under the leadership of President Cyril Ramaphosa and President Emmanuel Macron to launch the mRNA Technology Transfer Program. Today, the program includes the hub in South Africa and a well-established network of partners in other 14 low and middle-income countries, including 5 in Africa. We have also established the Biomanufacturing Training Workforce Initiative in the Republic of Korea, which has expanded to include other WHO-designated regional training centers for biomanufacturing in each region, including in South Africa. This is part of a global effort by scientists, regulators, institutions, and partners. Afrigen now serves as the quality-assured strategic platform for regional manufacturing, contributing to secure supply, pandemic preparedness, and Africa's health sovereignty. The next phase of the mRNA Technology Transfer Program must focus on sustainability, strengthening product pipelines, partnerships, and long-term capabilities. Together, we can build a more resilient global health system that can help to make the world safer for generations to come. I thank you.
And of course, none of this would be possible without the 15 countries that are part of this program, and in particular, South Africa. So I would like to call my next speaker, which is Professor Nicholas Crisp, who is the Acting Director General at the National Department of Health.
Good afternoon, everybody, and good afternoon to everybody online. I think before I say anything, can we just give a round of applause to Petra and the staff of this institution for everything you've done. So, as the health department, we are the end user, if you like, of the vaccines that get manufactured. And we are the ones that are ultimately responsible for getting those vaccines to the population who needs those vaccines. And we need to get it scalable to sufficient levels, coverage, to be able to get herd immunity under the circumstances such as we had during COVID, but also in the old diseases we tend to forget about. This is deeply personal for me. I was telling Pietro, I had no intention of doing what I do with my life. I wanted to be an orthopedic surgeon, and it was vaccine-preventable diseases that got me into doing what I do today and into administration. We had a polio epidemic. We had neonatal tetanus. We had massive measles epidemics. We had every number of vaccine-preventable conditions, and we still have diseases today that are vaccine-preventable. We are trying to roll out HPV vaccines. We desperately want an HIV vaccine. We need a better TB vaccine. We need all kinds of ways of preventing these diseases that we will not get if we don't invest in the capabilities of the mRNA technology that's available to us today. So from our side, from health, we will continue to support as best we possibly can. We will continue to work with our colleagues in the Science and Innovation Department, Trade and Industry, our Treasury colleagues, with WHO, the Medicine Patent Pool, and all of you who generously have contributed to making it possible to keep Afrigen running where it is now. But this is part one. This is just the start. It might seem like a rapid 4-year rocket ride to get to where we are today with this congratulatory message of the GMP certification. But this is just where it starts. So we need to really hunker down now and make sure that Afrigen goes into the next phase stronger than ever before, and that we all stand behind them And thank you very much for allowing us to be part of this today. Congratulations.
And so, of course, we wouldn't be here today without the support of many, many people, including our funders, but others as well. So industry has played, trade is such an important part. I'm very honored, we are very honored to have with us today Mr. Bernd Lang, who is the chair of the Committee of International Trade at the European Parliament. And of course, the EU is instrumental in this program. So the floor is yours.
Thanks a lot, Excellencies, ladies and gentlemen, dear friends. In 2020-21, I was member of the so-called contact group in Europe. This was a group built between the European Parliament, the European Commission, and sometimes the European Council as well. And we are faced with the corona pandemic. And we wanted to roll out vaccine to all people. And that was, in Europe, not an easy task. Who could produce this, and where are the facilities, and so on. But two of the lessons we learned are really vital. One lesson is a virus is not accepting any border, regardless the high of tariffs. It is spreading all over. And this leads also to the reaction all over. And secondly, we discovered that in whole Africa, there was no facility to produce vaccine. It was not really aware before in the mindset of European politicians. And based on these two lessons learned, we created really an approach to support the creation of facilities of research in the African countries to be able to produce vaccine and also have a proper possibilities to support also other countries. And this is in the context of our so-called global gateway project, which is bringing money from the European Union and the member states together to support projects specifically in the global south. And the manufacturing of and the access to vaccine is really one key element of this global gateway project, which is mobilizing a lot of European money, around about 2 billion. And also this project is really funded with a lot of European money, some also direct to Afrigen. And today we are here to look what is the achievement of this. And we were really deeply impressed, I have to say. Remember, 2020, 2021 is not so far away. And you mentioned the rocket path they did here in 4 years to create really possibility of production in a good manufacturing practice is really amazing. And to be honest, I couldn't imagine 2020, 2021 that this is possible. And therefore, I guess it's really 4 points I would raise at the end. It's really an starting point for the next phase. And you mentioned it as well. This is not the end of the story. We have to really go in the next phase and support the next phase. Otherwise, all the 4 years' work were really not going in the right direction. And I can promise you that we in the European Parliament are ready to supporting Afrigen in the next step. And regardless what will happen, we will stay to you in supporting the success of your work. Secondly, this is also a remarkable step in this certification process, the first in the African country. It's quite unique, so you can really be proud on that. And thirdly, this certification process demonstrates also that a highly regulated manufacturing capacity is possible to establish in an African country. Sometimes even in Europe we have problems with this high regulated manufactured processes. So really great. And secondly, it's a really quick process, and this is also really remarkable. And fourthly, I'm really deeply impressed that this is not only focused on South Africa, it is really transferred to 13 partner countries in the Global South worldwide. And this makes totally clear that pandemics, virus have to be reacted in a common way across borders. And I guess this is also a core principle of the European Union and the core principle of the partnership between South Africa and the European Union. We are working together across borders. We are working together in really favor of the people on the ground. We are really in solidarity, in humanity together. And therefore, I'm really happy to be here tonight to see the certification of Afrigen for the GMP. Thanks a lot.
I think we can give you yet another round of applause. Thank you. Your support really does mean a lot to us. Of course, again, as I said, none of this would be possible without our partners. So our next partner is the South African Medical Research Council. And I would like to introduce Professor Glenda Gray, who is the Chief Scientist at SAMRC, and also actually the Deputy Chair at SAHPRA Board, and the Director of the Health Research Institute for Infectious Diseases and Oncology Research Institute. Glenda. Thank you.
So good afternoon. It's a great pleasure to represent the SAMRC here today, and I'm honored that, that Professor Ntobeko Ntuzi, the current CEO and President of the MRC, has asked me to say a few words and convey our congratulations on this great achievement. Prof. Ntuzi can't be here today because he is attending the board meeting in Pretoria, and so he's asked me to share his congratulations with you. But let me start at the beginning. MRC's relationship with Afrigen began a long time ago, while I was still the president. The MRC was fortunate enough to incubate Afrigen at our premises in Cape Town, and we have witnessed the growth and development of Afrigen over time, from a few offices and some rented lab space to this campus, and this on our campus, to this impressive operation that you see here today. And this is because of the leadership of Petro, who is inspirational, committed, and visionary. And this milestone is really a tribute to her. So we should clap for her. I'm also proud that the MRC has contributed to the success of Afrigen mRNA Hub. The MRC was part of the initial collaboration that was conceived and built together to make sure that we could contribute to help building an mRNA vaccine capability after seeing the effects of vaccine inequity on our continent and the scramble, I'm sure you remember, Nicholas, the scramble to find COVID vaccines for South Africa. Afrigen has achieved this amazing goal to build this end-to-end capability to produce mRNA vaccines for South Africa, as well as serving as a resource for Africa and other low and middle income country settings throughout the world, not just in the global south. The Afrigen Hub, on achieving this GMP certification, demonstrates that investment in R&D pays off. It also demonstrates that local government investment in R&D is important in tandem with the kind of investment that we get from other parts of the world. So I want to acknowledge the South African government for investing in local R&D. I would also like to quote Professor Ntobeko Ntuzi, who remarks, Afrigen demonstrates what it looks like when scientific innovation is translated into real public health and manufacturing capability. As Afrigen enters the next phase, I like the next phase, the second phase, phase 2, MRC looks forward to working even more closely to help secure long-term sustainability and ensure that this platform continues to deliver on its promise for South Africa, the continent, and global health. Close quotes. Looking forward to the future, I'm reminded by the African proverb that personifies Afrigen. When the roots are deep, there is no reason to fear the wind. Afrigen and Petro, you have built a solid foundation, and we look forward to seeing you prosper. You have the potential to be catalytic for vaccine research and development, pioneering our growth as end-to-end vaccine developers and contributing to the goal of achieving vaccine equity for our continent. I thank you.
Thank you, Glenda. I will now come to my next speaker, who is a very special person to me, Professor Malboza Precious Motsoso, and she is indeed precious. She is the director of the Health Regulatory Service Platform at WITS Health Consortium, but she is much, much more than that. And I heard her introduce herself a moment ago. She has many, many formers as well. So, yes, exactly.
Thank you. Good evening, and thank you for inviting me to say a few words. Professor Ter Blanche, this is an important milestone, and to you, the team, partners, collaborators, congratulations. Today, we are not just celebrating Afrigen, but a continental effort. We're celebrating progress in Global South. It gave me such pride to hear the word R&D in South Africa. It's not common that you can associate R&D with any African country. Yes, manufacturing, yes, but just saying R&D gives me great joy. SAHPRA GMP certificate is an important milestone. You know, I said earlier that my name, you can just put former next to my name, former DG, former chair of negotiations, what? INB negotiations, former MCC, registrar. You can put any former, it fits my profile. But as a former regulator, I attach great significance to any manufacturing facility that achieves certification. You know, normally those who manufacture medicines or medical products, they always say it's a GMP plant. It's a GMP approved plant. You know, you can see how they attach importance to that. So we must not take this certification lightly. But it also confirms that Afrigen meets not only South African-based standards, but also those that WHO sets, because most of the regulatory agencies have to ensure that they align their requirements with those of WHO. And in that regard, by extension, it is also standards that are accepted globally. This could not have been achieved if it was not based on leadership that we have in New Petro, as Professor Glenda Gray said, but also committed scientists and experts that you have, an enabling environment, and partners that you have across the world and funders that have shown continued commitment. But we've also had an enabling environment that allowed you to innovate, and I think that matters. So for years, when you started, we had that mRNA vaccine platform in Africa. It's too complex, it's not gonna happen. But you know what, Afrigen, you've proven that it can be done. So this announcement shows that if we put our heads together, we can actually achieve results. But it also, with this certificate, it means that quality matters. Quality, particularly in the African continent, matters. It cannot be that the headlines about African products are about, do they meet qualities? Those questions should not be asked. It should just be automatic, it should be obvious. And these are the guarantees that we want. So to the Afrigen team, congratulations. You've shown that it's possible. To the partners, thank you. Thank you for respecting African leadership. And to all of us in this room, this certificate is just the beginning of a process towards the implementation of a pandemic agreement. And let's make it happen. I thank you.
Thank you, Precious. And now we move on to the beginning, or the next beginning, which is an important moment and why we are here today. So I'd like to invite the chair of the board of SAHPRA, so Dr. Thapelo Machudi, to come and say a few words.
Thank you, and good afternoon to everybody. I have to say, I wasn't supposed to be here. It was supposed to be the CEO standing here today and handing over this very beautiful certificate. But unfortunately, something happened and she couldn't make it, and she asked me to step in on her behalf. So I'm standing here today on behalf of the board of SAHPRA, which is, quite a privilege. My colleague is here, Glenda Gray, but she's here today wearing a different hat. But it's such a privilege to have her, speak on behalf of the MRC. I think if there was any doubt about the quality of the people on the SAHPRA board, now you have an idea of the caliber of the individuals who are on it. And so you can trust the regulatory processes that unfold in this country and as far as medicine regulation is concerned. I would like to thank the WHO, the MPP, and I would like to thank our boss, Nicholas Crisp, because as an entity within the Department of Health, ultimately Nicholas is our boss. And for those of you who might not be aware of it, Professor Crisp is the one who was quite integral to the development of SAHPRA. He essentially wrote the business case, and so it's a privilege to have him wearing a different hat today, but still nonetheless a part of this journey of building a wonderful regulatory regulator in South Africa. We've got Temi Gopal, who's currently the Chief Regulatory Officer, and so you should thank her, in fact, for this accreditation that you are receiving today. Now, when I was told to be here today, I thought I was just going to hand over the accreditation acknowledgement and then smile and take a picture. But just when I was having my glass of wine, I was informed that I need to say a few words. But it just so happened that when I was networking and mingling, somebody informed me that Prof. Tarablancha, you used to be at Nexa and Pelchem as well. Now, just by pure coincidence, I happen to have been the former chairperson of the National Nuclear Regulator when your VC at NWU was the CEO. So our paths have crossed in the past without us being being aware of it. And in recognition of your former role as an executive at Nexa, I thought of a quote that you might enjoy. So those of you who love science will be aware that in 1903, Pierre and Marie Curie won the Nobel Prize in Physics, but they couldn't travel to Stockholm to receive it because of a number of reasons, some of which included having ill health. So they eventually made it in 1905. And I just want to read something that Pierre said when he eventually received the Nobel Prize in 1905. He said, and I'll quote, "The question can be raised whether mankind benefits from knowing the secrets of nature, whether it is ready to profit from it, or whether this knowledge will not be harmful for it," unquote. Now, this was spoken in a different context, of course. I mean, they had just discovered radiation, which ultimately went on to be used to build atomic bomb and nuclear power. But in this context, I thought it would be relevant because what Afrigen is going to be doing ultimately is unlocking the secrets of nature, which is understanding the human immune system and introducing interventions to mitigate disease. And that's essentially discovering the secrets of nature. And we can answer this question definitively now, many years later, for Pierre to say that we know the answer. Knowledge will not be harmful. It will literally be very beneficial. And so it is a privilege for us as a regulator. And regulators are often seen with, sometimes we are not welcomed in terms of what we do because people sometimes perceive us as being a stifler of progress. But actually, no. We've seen how the world looks like when there's no regulation. We've seen in 2008, global financial crisis, that ultimately there was a failure of regulation. But we saw the good side of regulation in 2020 during the COVID crisis, that when you have regulators all over the world who are able to intervene and approve emergency approvals like vaccines, the world benefited from it. So we're quite grateful as a regulator to have been part of this journey. Our role is quality, safety, and efficacy. That's really all that we care about. We're not here to promote Afrigen, in case there's any doubt. We don't promote any product. We don't promote any entity. All we just care about is whatever that you're doing, is it safe? Does it do what you claim it does? And is the public going to benefit from it? That's really all that we care about. And I think with those few words, I'd just like to say that congratulations on this huge milestone. And people have been talking about phase 2, and hopefully we'll be a part of phase 2 as well, in whatever form. So with those few words, I think it's time for me to hand over.
So let me call up Ms. Mizelle Wolson, who's a responsible pharmacist here at Afrigen. And by her side, I would like Dr. Imelda Jordan to also come, because she's a deputy pharmacist here. And so if one has to be here all the time to make sure it's done. Tammy, you have to come too. This is your work. Yes, I think you should move over so that we can take some nice pictures. Okay. Stand in. There you are, together. Amazing. So stay with me. I'd also now like to actually bring up here is actually Dr. Karen Fenner, Elise Wilberg, Mustaqim Dagama, Helena Haystack, and unfortunately, Rajen Naidu can't be with us, but he is online, so we are virtually seeing him here, and they too are going to celebrate this license because it's a team effort, and they are here, but they represent everybody here at Afrigen.
And we have a leader who needs to
Come on, our leader. Come on, leader. What an amazing team. Thank you. So we'll leave the certification, which means that now, here we are at Afrigen, the GMP accredited location. So we're now going to get to the ribbon cutting. So I'm going to, oh yes, of course. Sorry, Karen.
Good evening, everybody. So I have this great privilege of being one of the Afrigen OGs since 2016. And the privilege of being the co-PI and technical lead of the WHO MPP Center for mRNA Development, Tech Transfer, and Training Program with Pietru since 2021. So it's with great pleasure that I say these few words on behalf of the team. And forgive me for my notes, this is obviously quite an emotional moment for us. So we've been able to achieve this milestone because of the can-do and pioneering spirit, hard work and dedication of the entire Afrigen team. The financial support of all the funders, many represented here today, our shareholders, the partnership that we've had with the within the SA consortium, which includes BioVac, the South African Medical Research Council, and obviously the support of the South African government, the Africa CDC, and the African Union. Also, our suppliers, our contractors, the scientific and technical support of all of our collaborators, the moral support and the confidence given to us by the 15 program partners, and a quite responsive and enabling environment provided by our regulator, SAHPRA. We've also had the support from our advisors and the program steerco. I acknowledge Martin Frieda as well, and the advocacy of the WHO and the MPP, leveraging their leadership role. The shoulder-to-shoulder, in the trenches support from the MPP Tech Transfer team. Thank you, Ike. So we've not only been able to build this GMP certifiable facility and team and an mRNA technology platform, we've also been training 15 partners, so this is no small feat. So, what do I say? To the world, I can say, Africa can. And we defy the cliche, because Africa can. Let's keep the momentum. This is truly a translational entity, end-to-end R&D and manufacturing, taking discoveries and knowledge through development to deliver usable biological products that will have a real-world impact. And so using AfriVac 2121, our proof of principle product, we've demonstrated vertical integration. So I'd like to take this moment to acknowledge the Afrigen team. Stand. Please stand, the managers. So these are our managers. They are at the coalface with all of the people who are working on the ground. We have demonstrated vertical integration from R&D, CMC and analytics, production and quality control, supported by the engineering and validation, facilities, supply chain, quality assurance and regulatory, and this is all underpinned by our quality management system with cross-functional contribution by all of our teams. It's represented here by these people, as well as these executives who stand alongside me. We shouldn't forget, obviously, functional support. Helena, how did you get to go sit down there? And legal, as well as our business development teams. And I'd like to give a shout out to Rajan Naidu, who's online. It's his birthday today. Happy birthday, Rajan. And now is the moment for the rest of the Afrigen team to please stand, every single one of you. So please stay standing. Receiving our SAHPRA license is one of the prizes. Remember, team, I've said, eyes on the prize. It's just one of the prizes. And I guess the ultimate prize for us, and what keeps all of us pressing forward, is health security for the people of South Africa, for Africa, and the world. This is just one stepping stone towards reaching that vision. And as Pietro always says, it's the ticket to the dance. And so lastly, and most importantly, I say to the entire Afrigen team, this includes everybody, from the faithful cleaning staff, general assistants, all the people on the ground, managers, executives, and our CEO, with all sincerity and appreciation. Halala, Afrigen. So for those who didn't understand, halala means this is indeed a public celebration, a communal recognition of your pioneering and tenacious spirit, remarkable hard work, dedication, scientific and technical excellence. Well done, and hearty congratulations. Thank you. You may be seated.
Thank you. I think we can clap again. Karen, well done. Yes. So we now move to the last part of our agenda today. And so I would like to invite up here, of course, Petro, you've got to stay, Charles, Claudia, Nicholas, Bernd, Glenda, Precious, if you would like to join us again. And of course, absolutely of course, our SAHPRA friends over there. So Thapelo Mashudi, I did it better earlier. And Tammy, come on, Tammy. And we're going to just bring our... You're going to be cutting. Well, I normally have them, but not today. So let's have you come. So you two come in the front, and then we need to go with Claire and Precious and bring around together, coming together. Are you ready? So 1, 2, 3, and go! That was the hardest job, yes. Thank you. And I will hand back to our host, Professor Terre Blanche, who is going to close this exceptional, emotional, and delightful ceremony.
So now that I'm emotional, I have to speak. So I'm just going to say thank you. Thank you to our online participants, Rajan, Barry Dutoy, connecting from the Kruger National Park, to our partners, our supporters, our funders, and those, all of you who have believed in us from day one. This is not over. This is the next phase. Keep us in eye and be sure we'll be around and we will continue to contribute and go from strength to strength. And this is for the Afrigen team. Hats off, guys. Thank you. Thank you. Enjoy the evening with us.